Thanks, Abe. Yeah, my name is Jonathan Groner, Groner. I'm a retired surgeon. I did trauma, burns, and acute care. I ran a pediatric trauma center here in Columbus for about 20 years. Cared for a lot of gunshot wound victims. So I have some knowledge of it. I've had the opportunity in my research for a forthcoming book to look at the autopsy photos, not just of Mr. Gardner's brother, but also of the two firing squad executions recently in South Carolina. So I have sort of some comparison and some comments to make on those. Um, it's obviously a very violent death. Um, and we can take a look at the autopsy photos and I can make some comments. So this is a close-up view of Mr. Ronnie Lee Gardner's chest. And the nipple that you can see is his left nipple. So my comment here is that although people, like when you do the Pledge of Allegiance, you put your hand over your left chest, that's where you can feel the pulsation because that's where the left ventricle sort of, as it beats, sort of radiates out that area. The heart is under your sternum, it's under your breastbone. And if you need proof of that, look at anybody who's had bypass surgery. Their scar is on their sternum. And I've assisted with a bunch of heart operations when I was a resident. I did a few myself for various things. And we split the sternum open and the heart is right there. And so the fact that these bullets are sort of lateral, meaning to the left of or past his left nipple is to me concerning that some of these bullets may not have gone to where the heart is. You can see that there's huge cavities, so they obviously made big holes, but it's just not where I expect. And at this point, I've seen the autopsy photos of Mr. Sigmund's execution. He has three bullet holes and they're on the other side of the nipple and they're very closely spaced. He was only shot by three people, not four. I've seen the bullet wounds of Mr. Mahdi's execution. His bullet wounds seem like they are nowhere near his heart, and we can discuss the reasons why that might have happened and what that means. But in theory, the firing squad execution shouldn't be botchable, right? The people firing the guns are trained to fire guns. They're 15 to 20 feet away, and they practice. So why some people seem to get it done right and some don't is an interesting thing that might be worth discussing.
You shared with me your supposition that there was a purposeful miss in, at least in South Carolina. I mean, it seems clear here too. Do you want to discuss that at all?
Sure. Well, I mean, I researched this pretty extensively for my forthcoming book. I mean, the best as I could, hours studying the photos and trying to use a little measurement there to figure out. So, Mr. Sigmund had killed some family members, and he was white. I just put that out there. Mr. Mahdi had killed a law enforcement officer, and I don't, that is a very considered by the whole law enforcement community to be an extremely severe crime. Um, and so, I mean, it's an open question, in a former Confederate state, would they treat a black man who killed a police officer differently than a white man who killed some family members? It's out there, and you can look at the bullet wounds, and they're very, very different. I don't know if the people doing the executions were the same three people, but the bullet wounds are very, very different. And if you read the accounts of what happened to Mr. Mahdi, it is quite clear that he did not die quickly. I think every witness saw movement for a number of seconds. I can't remember exactly. So um, it seems possible that there is some, sort of implicit bias in the execution process. I don't know anything about Mr. Gardner's history, if we would have done any things that would have upset the guards or made them mad or whatever, but given the location of bullets, you have to at least ask that question.